Hello, everyone. This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan, and Greater Los Angeles, California. A warm welcome to all our new members and listeners who have joined us. It is a pleasure to have you on and to listen to what is going to be objective evidence. It is not going to be my opinion, and we will go ahead and answer any questions. So, having said this, if you think of any questions, please go to the comment section and write down your question. If you have any specifics, anything like that, we will be doing this routinely on a Monday afternoon/evening, so I can answer any of the questions. So I just want to kind of recap. There is a interesting consult I did over the weekend. This was a nice lady from California, and she was asking me specifically that she wanted to get implants. Very normally it is a consultation for a breast implant removal. And so she wanted to ask me if she should get implants or not. And I said to her, well, I'm not going to make that decision for you. You're the boss. She needs to decide, knowing the risk versus benefits. So what I did was I went over with her what is objective hard evidence that we know of, not my opinion. And as you will see, this is the breast implant, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff, issued by the U.S. Food and Drug Administration. This was issued in September of 2020. So I want you to go ahead, and each one of you who's interested in getting implants or who have implants, they should go ahead and at the bottom of page 9 read this black box warning. So I'm going to read out to you what I read out to her. If you're considering implants or if you have implants, it says, quote, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. So that means the end result is always going to be bad, be it a rupture, contracture, in that very rare situation, BIALCL. You will have other problems that will arise that I'm going to read shortly. Also, the second part of the black box warning, it says breast implants have been associated with the development of the cancer of the immune system called breast implant associated anaplastic large cell lymphoma. This cancer occurs more commonly in patients with textured breast implants than smooth implants. That means the smooths are also implicated. Although rates are not well defined, some patients have died from BIALCL. So they're telling you it's a direct association between the implant and the BIALCL. And then the third thing, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Well, this is what is called breast implant illness, and we know it exists because they're telling you it exists, and we hear it from the patients. The next sentence, individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Now, this is very real. So they're telling you, number one, they're not lifetime devices. The longer you have them, the higher the chances that you're going to have complications. They're telling you that there's an association with that rare lymphoma, not only the BIALCL, with the BIA-SCC as well, which is the breast implant associated squamous cell cancer. Now, this is also another type of association directly with the implants. And then they're telling you breast implant illness. Just within this small paragraph, you have so much information. Now, in reality, if you look at my patients from last week, I had two patients last week with Motiva implants. These are the new or better 6th generation implants. One patient had the implant just for 8 months only. That is a nice lady in her mid-30s, and she had implants for 8 months only, and she said that her whole body was literally on fire and she absolutely needed to get them removed. And she came in from Milwaukee to get her 8-month-old Motiva implants. There was another patient that came to me from 2 years ago, all the way from Mongolia, and she had implants which were the nano micro textured Motiva implants, and she had the symptoms go through the roof when it comes to what are suggestive of what is breast implant illness. And it goes to showing you there is no such thing as safe implants. No one will tell you all implants are safe because this black box warning is telling you. Now, what are the risks associated with implants? Again, not my words. I told her you will get, quote, risks of breast implant surgery, and they want you to initialize. This is the FDA paperwork, remember. Breast pain. I understand that the risks of undergoing breast implant surgery include breast pain, skin or nipple areola sensitivity changes, asymmetry, impact of aging or weight change on size and shape of the breast, infection requiring possible removal of the implant, swelling, scarring, fluid collections, hematoma, tissue death of the breast skin or nipple, inability to breastfeed, bleeding, chronic pain, damage to surrounding tissue such as muscle, nerves, blood vessels. And then if you read, it says over here that my physician has discussed these risks and has provided me with the patient information, patient initials. The other risks involved include that on the bottom of page 14, right here, and it's you will see over here, I understand that all breast implants can interfere with mammography and breast exams. So the self-monthly breast exam and the mammogram is going to be affected, which could delay the diagnosis of breast cancer. This is a big deal. 1 out of 8 or 9 women will get breast cancer. Do you want to delay the diagnosis of breast cancer? Not my words. These are the words of the FDA. Mammography can also cause the breast implant to rupture or leak. Today I saw a patient, she said she was traumatized by the mammogram experience and she does not want to get mammograms, and look, now she's afraid to get mammograms. I should tell the mammography technician if I have breast implants. So this alone would be a reason not to get implants, to screen for breast cancer. And remember, 1 out of 8 or 9 patients will get breast cancer. So you do not want to delay the diagnosis of breast cancer. What are the other risks? I understand the long-term risks of breast implants may include painful or tightening of the scar tissue, that is the capsular contracture, a rupture or leaking of the implant, wrinkling of the implant, visibility of the implant, shifting of the implant, need for reoperation, and then they want the initials. Now, if you read at the top of page 14, it says, I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph nodes, under the arm, and organs, liver, lungs, where it may not be possible to remove. And then it says, I understand that all breast implants contain chemicals and heavy metals. I understand that most of these chemicals stay inside the shell of the implant, but small quantities have been found to diffuse gel bleed to the implant shell of the silicone gel filled implants, even if the implant is intact and not ruptured or leaking. A list of these component chemicals are listed. And then if you look at the list of the chemicals, you have arsenic, barium, beryllium, cadmium, chromium, cobalt, copper, lead. And to continue, mercury, nickel, platinum, selenium, silver, tin, titanium, vanadium, zinc. Just from what I have read, from that, they're not lifetime devices, meaning the ending is not going to be a good, happy ending. Meaning the longer you have them, the higher the chances you're going to have problems. One of the patients I saw today in clinic, she said, the longer I've had them, the more problems have accumulated. And this is consistent with what the black box warning, and again, not my words, this is not my language, these are the words of the manufacturers and the FDA concluding that it's on every box of silicone implants that is supposedly sold, and unfortunately the patients do not know about it. Why would someone want to get implants that ultimately have only a bad ending? They only hurt the body, they only harm the body, they're associated with lymphoma, they're associated with pain, contracture, rupture. If you look at the guidelines, as far as recommended follow-up, look at this page, bottom of 14. Even if I have no symptoms, I should have my first ultrasound or MRI at 5 to 6 years after my initial implant surgery, and then every 2 to 3 years thereafter. If I have any symptoms, or if I have symptoms or uncertain ultrasound results for breast implant rupture at any time, an MRI is recommended. So if you look at the best test that's out there is an MRI. At year 5 is what they're saying. And if you look at the guidelines from Mentor, they tell you get an MRI at year 3, and then every 2 years they're onward. And this is what is objective evidence. We know that this is real, and the whole idea here is what? Informed consent. So you know if you're hurting, you need to know that there is relief out there. You know that the entire capsule implant inflamed tissue must be removed. In my practice, the entire capsular tissue is sent to pathology. Cultures are done for bacteria and fungus, and you have the implant returned to the patient. Twilight lead sedation. No need for the drains. I've not used drains in well over 6 years. When the surgery is done correctly and completely, the need for the drain is not there because there is no bad tissue that's there remaining behind that will induce fluid formation or inflammation formation. And this is where you, as the patient, you have to do your homework and your due diligence, and you have to understand what is the whole essence and purpose of the explant. Nowadays, you have a lot of influencers, nurses who work for the doctor's office, other patients who are paid influencers who are basically vouching for the surgeon. This is not the standard. The standard is you need to go look at the surgeon's high definition pictures and videos of the chest wall showing complete removal of the entire implant capsule, all inflamed tissue, and that is the only and ultimate proof. Don't go to a list that was prepared by the surgeon's office that basically puts his name on that list and basically glorifies him to be a world expert. This is literally on the job training for the plastic surgeons. Nowadays, almost every surgeon in the United States is offering an explant, supposed en bloc total capsulectomy, but you will see that they're still augmenting, they're still doing the fat grafting, they're still doing all of these other procedures in 60, 90 minutes, 2 hours or less, and they're not physically removing the capsule. So do your due diligence, do your homework, talk to the surgeon directly. Do not be motivated by another patient who's writing a good remark, be it me or anyone else. You want to talk to the surgeon directly. You want to get that consent form that specifically states that the 100% total capsule will be removed, preferably in en bloc fashion, or 100% total capsulectomy will be done. The capsules, that in itself, and photographs will be taken of the chest wall showing complete removal of the implant capsule, that the capsules will be and must be sent to pathology to rule out the BIALCL. That is in itself proof that the entire capsular tissue was indeed removed, that the diameter of the implant dictates the length of the incision. Approximate time is 4 hours plus minus of the nature and length of the surgery. The implants are returned to the patient, and then the surgeon has that track record, that confidence that the surgeon is definitively and completely removing the capsule, which in my practice means that the fascia of the intercostal muscle, fascia of the serratus anterior, fascia of the pectoralis minor is removed, along with the periosteum and perichondrium if the implant is below the muscle, because that is the only and the ultimate proof that the surgery was done in the manner as described. Do we have any questions?
No.
So the goal here is to do your homework, understand the mentality of the surgeon. Remember, there is no true textbook that describes this en bloc as to how it's done. It is very surgeon specific, surgeon dependent. Today I saw a patient who had implants from 1991, and I will say this to you with confidence. If she goes to 100 plastic surgeons, all 100 of them are going to tell her remove this set and put another set in. Now she is very firm about only removal. Now, even when she goes to these surgeons, most of the surgeons will just remove it and say, well, you should do a lift, you should do this, you should do that, but they will still want to do more procedures. Remember, the whole goal of the surgery is just the fact that her implants are from 1991, 35-year-old set of implants. They are very likely ruptured, and she did say that they were picked up on a mammogram as ruptured. The entire implant capsule, all inflamed tissue must be removed in en bloc fashion or 100% total capsulectomy, and that the capsules must be sent to pathology, cultures for aerobic and aerobic and fungal, and liquid, whatever, if there's any fluid around, must be sent to cytology to rule out that rare lymphoma. And a full, comprehensive, definitive workup must be done by your surgeon so that you're not second guessing the process. Do your homework, do not rush into the surgery, do it correctly, do it once, do it with definitive certainty, do your homework, look at the surgeon's YouTube videos, TikTok lives, Facebook lives, Instagram lives, and you should have that capsule or tissue that must be sent to pathology and those high definition pictures. I cannot emphasize to you enough. I talked to a patient. I actually just saw a patient today. She had her explant surgery done by another surgeon in Ohio, and her capsules were left behind her. She had seroma chronic on the left, and also a seroma that spontaneously resolved on the right. And she basically came to me with residual capsules, and lo and behold, I did remove those, and we will hear directly from her in the next several weeks. Now, the bottom line here is share your journey, share your experiences with the many others, talk about it. It is very healthy to discuss your symptoms with your board certified plastic surgeon so that if you're hurting, you know that there's relief out there. And lastly, but not least, I will end with this: do no harm. If plan A fails, plan B should not be the same as plan A. Do your homework, follow the surgeon's Facebook site, YouTube. Do not be influenced by another person who does not know anything about medicine, who is a paid influencer, who's guiding you to the surgeon. Do not listen to any of these positive remarks from other patients, be it me or anyone. Talk to the surgeon, see those high definition pictures and videos, and feel that contentment that you signed up with a surgeon who truly from his heart cares. This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan, and Greater Los Angeles, California.